Hi, my name is Rachel Hazlitt, and today I'll be presenting our research on data sharing trends in core otolaryngology journals, a cross-sectional analysis. So a little bit of background. Otolaryngology plays a critical role in overall health, with over $1 billion in NIH funding spent over the past decade. Despite the many benefits of data sharing, such as fostering innovation, enhancing reproducibility, and reducing redundancy, the adoption of data sharing practice remains inconsistent. Ethical, privacy, and intellectual property concerns continue to hinder progress, even as FAIR principles guide data sharing initiatives. Our research seeks to answer the following question: what are the current trends and factors that influence data sharing practices in core otolaryngology journals? So, for our methods, we analyzed articles from 8 core otolaryngology journals over a 5-year period to include 2018 to 2023. We included original research with primary data and excluded reviews, single case reports, and systematic reviews. Data extraction focused on bibliographic details, funding sources, data sharing content, repository use, and accessibility of data. Thematic analysis of data sharing statements and correspondence with authors helped to clarify sharing practices. Our results showed that from 1,205 articles screened, 1,180 met inclusion criteria, with 201 of these including a data sharing statement. The key findings of our results include less than 15% of manuscripts included a data sharing statement, though some journals, like Head and Neck, achieved over 85% inclusion by the year 2023. Study design, funding sources, and accessibility did not significantly impact data sharing statement inclusion. Gatekeeper themes, where authors controlled access to the data, appeared in 73% of data sharing statements. Conditional availability and privacy concerns were common additional themes. Only 7% of manuscripts utilized open repositories. Notably, only 23% of authors responded to data requests, with 74% willing to share data unconditionally. This highlights significant variability in data sharing practices. We identified some challenges to data sharing to include a lack of standardized repositories that are tailored to the field of otolaryngology, time and financial burdens on authors in terms of data sharing and the resources that it requires, and the reluctance driven by competitiveness and privacy concerns within the research field of otolaryngology. In conclusion, the variability in data sharing practices limits research transparency, research reproducibility, and research collaboration. This ultimately hinders evidence-based advances in clinical outcomes. To address this, we recommend establishing centralized, user-friendly repositories. We recommend that journals should adopt standardized and enforceable data sharing policies. And we recommend incentives such as funding and recognition to encourage data sharing compliance. By addressing these challenges, we hope to improve data availability and enable broader and more robust analyses to advance patient care. We would like to acknowledge the OSU Center for Health Sciences library staff for their contributions to this work, as well as the Vassar research team and everyone on it for their contributions to this work as well. Thank you for listening, and have a great day.